My name is Karen Chetcuti and I'm a radiologist, UK trained. I've been living in Malawi for the past 4 years. I lived here for 1 year before that. This time, over the past 4 years, I've been employed by the Kamuzu University of Health Sciences, also known as KUHeS, and I function as a radiology lecturer and therefore an educationalist here in country, but also as a service provider in the hospital, the Queen Elizabeth Central Hospital in Blantyre. So given that in Malawi there are about 20 million people living in this country, and given the statistic that there were, before I was here, 3 radiology consultants tending to the 20 million plus, that to me was a stark ratio which was so discrepant when compared to other countries and continents. And so when I was approached with the offer of helping to make that change, helping to homegrown Malawian radiologists with the hope of, having more of a success with retention of radiologists in the country, which would ultimately help to develop the specialty in the country, which wasn't really happening, and which in turn would also help the other subspecialties to develop. I bought into that vision and into that scope and objective. And so that is what I have been focusing on for the past 4 years. So when I was asked to set up and implement the first radiology residency program in the country, my focus was on what the product would be. And the product would be a general radiologist, first and foremost, who's developing a subspecialty interest. But as we know, when each of us are working through a radiology residency program, we are taught by radiologists who are experts across several subspecialties. We are exposed to many different imaging modalities and many different styles of teaching and practice, which we all learn from and then adapt to make our own. And so that is lacking. When you have such few radiologists on the ground, you can't achieve that kind of holistic or variety of approach and expertise that is necessary to produce that end product. And so we were really lucky in that Worldwide Radiology had already a strong relationship with the college, with the hospital where the residency program is occurring, and we built up on that existing relationship to then help to fill the paucity and the gaps which arise when you are creating a residency program from scratch in such a country. Luckily enough, through Worldwide Radiology's other partners on site, we managed to create the infrastructure to allow for this remote relationship to occur. And so Worldwide Radiology has been incredibly impactful in allowing my trainees to experience, the variety that is needed for a holistic nurturement of such trainees. I am a pediatric radiologist by trade, and that means and also translates into the fact that a radiologist cannot really be an expert on every different body type of radiology. And so very early on in our collaboration with Worldwide Radiology, we were introduced to a reporting radiographer based in London. And one of his specialty areas is in musculoskeletal radiology, which does not happen to be my subspecialty area, and yet my students need to learn it properly. And so that to me embodies one of our early successes which has been a sustainable success to this very day, and is an example of a committed volunteer individual who is affiliated with Worldwide Radiology, who through weekly remote lectures has built the entire repertoire of musculoskeletal radiology that my trainees know and which I was not able to deliver myself. Through this professional relationship, my trainees have learned musculoskeletal radiology from this volunteer. They've learned different styles of reporting and how that translates to the clinical patient. And so not only one patient has been impacted here, but all of those patients who have come into the hospital with a musculoskeletal condition, really, who have passed through radiology. And so throughout this year, because we've had committed volunteers via WWR, with this only being one case example, an entire curriculum of cohorts of diseases has been covered. And that, as the program lead here of this radiology residency, has given me a lot of reassurance, knowing that that particular area of the curriculum has been delivered in a sustainable and comprehensive way. One example in which I can think about where a Worldwide Radiology volunteer has really impacted on a particular patient has been in the case of an adolescent with a jaw mass. This jaw mass was examined by the head and neck clinical team here at Queen's, and subsequently the patient was referred for scans to further evaluate that jaw mass, to then allow the clinical team to decide on how best to manage the patient. Is it a benign or malignant lesion? Is it operable? What is the sort of impact on the surrounding structures? And then through having a WWR volunteer who was recruited as a head and neck specialist volunteer, being able to share the images from this Malawian boy with the expert overseas, and then receiving that expert report, really did translate into direct impact on this patient's jaw mass management. The referring team understood exactly where that mass was located and which approach was best to access it, to remove it at surgery. But besides the impact on the patient's management itself, that also translates into further teaching for my students, who review the report. We do that as a team, the report which is sent by the expert, and then we kind of learn from that as we re-review the image and reflect on it later. I think that Worldwide Radiology is a crucial partner in the development of radiology in Malawi as a country, and so almost beyond the residency program. I think at the moment we are focusing on radiology residents, but there are so many different cadres of radiology healthcare professionals, and also healthcare professionals who are not radiologists or radiographers, who need to have a baseline knowledge of radiology. Healthcare professionals located in the districts, for example, they need to be able to have some basic understanding, actually more than basic, to be able to tend to their patients at the point of care. And so I hope, and it is my strong hope, that the collaboration with WWR flourishes and grows. Grows in strength, but also in the different kind of realms, and grows into impacting education not only centrally for radiologists, but also beyond. Currently, there are 5 radiology residents in training, with 2 more to start in September. And so that results in Malawi having 7 radiology residents in all, who are working towards becoming the first homegrown Malawian radiologists. They will need support. They'll need support not only on individual cases, tricky cases, but also into further developing educational programs, into policy making, into management and infrastructural advice. And so I think the way in which I would hope, and the way in which I believe that WWR can support the up-and-coming Malawian radiologists is, in fact, in this holistic approach, which it already is inputting into. But I think then it would have a more advanced role, a more mature role, and a stronger role as a partner of the leaders in this country for radiology.